Hi, hello everyone. Welcome to my channel. Let's study obsessive compulsive disorder or obsessive compulsive neurosis in 5 minutes. Obsessive compulsive neurosis has two words, obsession and compulsion. Obsession relates to the thoughts which keeps on creeping in the mind or brain, and compulsion is the acts which the patient should be able to resist but is not able to resist it. It may begin in childhood, often seen in adolescence. Commonly, it is seen equally in men and women. Many obsessive compulsive disorder patients may have depression, panics, or social phobia, eating disorders, personality disorders as comorbidity. Relatives of obsessive compulsive neurosis may have obsessive compulsive disorder around 35%. Etiological factors, there are four major things: genetic factors, biochemical theory, psychoanalytical theory, and behavior theory. Out of which genetic theory says monozygotic twins are more uh, affected, first degree relatives with 35% of them. Biochemical says 5-HT, that is serotonin abnormality is more seen. Psychoanalytical theory, according to Sigmund Freud, regression to an infantile superego. Remember, harsh parenting or punitive parenting during the childhood may may be a leading cause to regression, so that the child may go into a pre-oedipal or anal sadistic phase, and in combination with specific ego mechanism, that is isolation, undoing, displacement, and reaction formation. Remember these four defense mechanisms which are abnormal and are seen in a patient with obsessive compulsive disorder. I repeat: isolation, undoing, displacement, and reaction formation. Behavior theory says obsession are conditioned stimulus of anxiety. That means this is a vicious cycle. When an anxiety arrives, the patient goes into an action which relieves that anxiety, and after some time again the anxiety creeps up and the patient goes into an action, and this cycle never ends. So this particular cycle ends up into a reinforcement of compulsive act. That means the patient continuously does those acts and has those thoughts which keep him doing the same thing again and again, and ends up into having obsessive compulsive disorder. The clinical manifestations may also be considered as the types of obsessive compulsive disorder, that is, obsessional thoughts, obsessional images, obsessional ruminations, obsessional thoughts, obsessional impulses, obsessional rituals, and obsessive slowness. How to diagnose? Again, ICD 11 says 6B20 as classification. MRI CT might show an enlarged basal ganglia. PET scan, that is positron emission tomography, shows increased glucose metabolism in the patients in basal ganglia. The therapies, medications, antidepressants, sertraline is usually given, anxiolytics, very important, benzodiazepines, and other therapies are adjunct therapies, an important aspect of the treatment of obsessive compulsive disorder, that is behavior therapy and other therapies. Behavior therapy, exposure and response prevention, thought stoppage, relaxation, desensitization, aversion conditioning are very important. ECT may be given in refractory patients, that is, who are not supportive or who are not able to recover even due to drugs. Supportive psychotherapy plays an important role. Remember, medications plus adjunct therapy are both used here. Cognitive behavior therapy also is an important part of obsessive compulsive disorder treatment. Nursing diagnosis, again, we have to focus on the clinical manifestation, ineffective individual coping, altered role performance, and depending on the clinical manifestations, we can make nursing diagnosis which may be helpful. I hope I must have cleared a bit of information regarding obsessive compulsive disorder or obsessive compulsive neurosis. If any queries, kindly comment. Support my channel by subscribing, sharing, and following. Thank you very much. Kindly like, subscribe, and follow my official YouTube channel. Thank you.